right, so this is my very nice patient who came to see me with a droopy eyelid problem. As you can see, she's got quite a bit of saggy of the skin, and you know that she has sagginess of the skin because you can't see where her lashes are coming from. And that's because this sag of skin is covering the lashes, no different from a beer belly covering over someone's belt. And so our very nice patient had this surgery, and so this is what she looks like today. Wow, it's such a dramatic change from what you looked like before. Your eyelids, again, from here, you looked much more kind of droopy and tired and all this excess skin. And then now we can actually see your lid margin. So that's what we're talking about. You can actually see the edge of the lid and you can see where the lashes are originating from. And that means that droopy skin around the lid has been removed. So tell me, what was the surgery, or what kind of symptoms were you having? What surgery was like, and how are you doing now?
Well, I noticed that I wasn't seeing as well, that I had to look up to see things, or I had to turn my head to the left or right to see things. The surgery was great. I didn't even really need the pain medication. I took it the first day, and that was it.
Wow.
So overall, I had no problems with the surgery.
And how about the healing? There's some bruising and stuff after.
There was bruising afterwards, so for about 10, 14 days, it was pretty rough. You didn't want to go out in public.
No.
But after that, it was slowly got better.
Great. So, I mean, you look amazing. I think it's so much better. Obviously, your vision's better. Do you feel also like the lid, the weight has been lifted off the eyes?
I do. I feel like it's
And how about your tiredness of the eyes? Is that better?
Yes, much better.
Yeah, that's neat. And you did tell me one thing, and it's important for our viewers to know. After we remove all that skin, it makes the skin tighter. And so sometimes people can have some dry eye problems. And so you have had some of that.
I have had dry eye.
Right. So you might have had dry eye problems before, but then you had the surgery and it actually makes it worse for a little bit.
Yes.
But you'll have to just use artificial tears and continue to keep your eyes nice and closed when you type, because we remove all that excess skin.
Right.
Well, so in general, if someone else came to you with a saggy eyelid problem and they were just talking to you about it and were scared about it, what would you say to them?
There's not really any reason to be scared. Like I said, the surgery went fine. It wasn't painful afterwards. And the results are great, afterwards. So like I said, I can see much better, and my eyes just feel better.
Great. Well, thank you so much for sharing your story. We'll really appreciate it.
All right, thank you.
You're welcome.